Good morning. We want to look at the second part of motivational interviewing. In our previous lecture, we explored the spirit and philosophy behind motivational interviewing. Today, we want to focus on the practical skills that make MI effective in clinical settings. As you watch, pause to practice the exercises and imagine yourself in the therapist role. How are we going to do this? We want to, as part of the learning objectives, demonstrate what the OARS skills are, differentiate simple versus complex reflections, identify MI consistent versus MI inconsistent responses, respond skillfully to resistance, and then practice culturally responsive MI in African contexts. Remember that motivational interviewing or MI is an evidence-based, patient-centered counseling method designed to help people resolve mixed feelings. And in MI language, they call that ambivalence. So ambivalence about change. It's also meant to help them strengthen their internal motivation to adopt healthier behaviors. It is collaborative, it is non-judgmental and conversational style. It's not directive and is meant to empower individuals to find their own reasons for change. So remember, MI is not persuading. MI is not forcing. It is not coercing. It is not advising. The essence of MI is to help clients discover their own reasons for change. All right, so we want to look at how do we move from the spirit of MI to the skill. So when we say that, we mean how do we journey from moving from understanding the underlying philosophy. So the underlying philosophy is the way of being, just like it is for many of the theories that we've been talking about in this season. So just your way of being, moving from that to implementing specific techniques. So from the philosophy to the way of doing. So from the way of being to the way of doing. We want to look at how MI is not just a set of tricks to manipulate behavior, but a heart set and a mindset that must precede the use of technical tools. So it's not a therapeutic intervention that is, oh, no, 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 I like these tools, let me use it. A heart has to follow it. Okay. So the spirit is the foundational humanistic approach to counseling relationship. It involves four elements, often remembered by the acronym CAPE. CAPE is compassion, acceptance, partnership, and evocation. I'm just doing a little revision from the other one. Okay, so the skill is the technical component, and the skill is often referred to as oars. Like think of a fisherman going fishing. The thing they use when they're in their canoe is called an oar, so oars. And these are specific behaviors that operationalize the spirit of MI. Okay, so um, we look at O as in open-ended questions, A as in affirmation, R as in reflections, and S as in summary. So MI is relational first before any technique can happen. So if you use the technique without the relationship, the technique without the spirit, then MI just becomes manipulation. So if that's the way you want to go, then we'll say that you are a manipulator. But if you want to carry the spirit before the skills, then we know that you are practicing MI person. So what does the OARS framework look like? We talk of O as open questions, and I'll walk through each of the acronyms with you. A is affirmations, R is reflection, and S is summaries. Remember, MI is relational first before any skills follow. Without the relationship, you can't do MI effectively. Okay, so when we say O is open questioning. You invite elaboration. You are asking questions in a way that can't be answered with a yes or no. If you say, do you want to stop drinking? It's yes or no. Instead of that, you say, what are your thoughts about your drinking? What concerns you about this? How has this affected your family? Okay, so any question that encourages exploration, but that doesn't just lead to yes or no responses, that is open questioning. And you are asking from a place of curiosity and non-judgment so that a person can feel the acceptance. Now, I have a few exercises for you. Pull out your notebooks and your pens or your pencils. If you don't want that and you want to use charcoal to write on the floor, that's also good. Just make sure the floor is yours. I'm going to give you a series of closed-ended questions, and I want to see if you can rewrite that as open questions. If you don't practice, you won't be able to do it. So first question, do you take your medication regularly? Now rewrite that as open question. Are you done? So my version of it will be, what has it been like managing your medication? What has it been like managing your medication? All right, so we've done the O, that's open questions. Now we do, in using the O again, you have to recognize a person's strengths. You have to reinforce their values. You have to build their confidence. And an example is when a person gives you an answer and you recognize that they have thoughts about it. It's like, you've thought deeply about this. Or something like your children are clearly important to you. So if we're doing counseling skills class, we'll say that this is a reflection of meaning. Reflection of meaning. So when a person talks, you're connecting it to something that clearly means a lot to them. Okay, so that's the second part to open-ended questioning. Now we are going into affirmation. Remember, affirmations are not flattery. Actually, this is part of affirmation. So in affirmation, you're recognizing a person's strengths, you are reinforcing their values, and you are building their confidence. It's not flattery. It's something that you've noticed about what they are doing. You recognize their strength, you reinforce their values, and you build their confidence. So after you have used the open questioning and you've asked questions that don't lean themselves to yes or no, then you reflect based on their strengths, their values, and their confidence. All right. So in reflective listening, which is actually the heart of MI, MI is very reflection heavy. So there's a rule of thumb. It doesn't mean you have to engrave that in stone. So you have to normally do maybe 2 reflections per question. And in reflecting, what you're doing is you're mirroring the meaning, you're showing that you understand, and you're moving the conversation forward. Many beginner counseling students or therapy students assume that, no, if I don't ask questions, how will I get answers? But many times the open-ended questions and the reflections allow your client to delve deeper into what their concerns are beyond the curious yes and no type questions. Let's see if we can have some examples of that. We have simple reflection and complex reflection. So simple reflection just repeats or slightly rephrases. So client says, I'm tired of arguing, and the therapist will say, you are exhausted. But when you the complex level, you are adding meaning or emotion to it. And this is where anytime I teach clinical skills, I will teach students to understand the levels of reflection. So I'll say, let's do a reflection of content. And then as we do that, we'll add a feeling to what the content is. And then as we do a couple of feelings, then we connect a meaning to it. And if you don't sit in the therapeutic space using a humble posture, you won't even hear. And this is not hearing with the ears. This is hearing with the heart of what the client is saying for you to engage in both simple and complex reflections. So when the client says, I'm tired, your simple reflection will be, you are exhausted. Remember, it's not you are exhausted. No, it's you are exhausted. So it's a reflection. You are stating it. Then if you want to add some um, complex meaning or emotion to it, you will say you are beginning to question whether this relationship is healthy. Again, this is where you are connecting what a client has told you about probably fighting with a partner or something and they're just tired of arguing. And so because you've listened with your heart to what they are saying, it makes it easy for you to connect an emotion or meaning to that. Now I have actually mentioned that briefly. So we have different types of, let me take you back a bit. Remember, two levels of reflection in MI. We have simple reflection and complex reflection. Within the complex reflection, we have reflection of feeling reflection. We have meaning reflection. We have double-sided reflection and amplified reflection, which we will say you should use cautiously. Now, we have already talked about feeling reflection in the other slide and meaning reflection. What does it mean to do a double-sided reflection? So a client says something like, I want to stop drinking, but it's how I relax. And then a therapist will come in and say, drinking helps you cope. And at the same time, you are worried about its effects. I'm going to do that again. Client comes in, but therapist, I really want to stop the drinking, but then it's how I relax. And because you're listening with your heart, you can do a double-sided reflection of you recognize drinking helps you cope because that's what they're saying, how I relax. And at the same time, you're worried about its effects. That's where, so it's double-sided, but it feels like you're reflecting the bottom before you reflect the top. Do you get it? Let's see if I will give you some examples. So we have a client who is supposed to take medication, but they're not really taking it well. And so the client says, I know I should take it, but my aunt says these drugs weaken the body. What kind of double-sided reflection will you do? Write it down. So while you're thinking through that, if it is a simple reflection, I'll probably say you've heard concerns that the medication might harm you. And the client may probably come back and say, yes, and I don't want to damage my body. And so in doing that, what kind of double-sided reflection will I do? You want to protect your health and you are unsure which path truly does that. And many times when you do this, well, a client will say, exactly, I don't know who to believe. And so this is where a therapist can come in and use evoking. So I come across a client who says, exactly, I don't know who to believe. Then I'll come back and say, what matters most to you when you think about your long-term health? You realize I'm using open-ended question. So I haven't done confrontation, I haven't done correcting, I haven't done shaming. I have coming across from a place of curiosity and from a place of humility. Because, like Carl Rogers said, just being human is hard. And so nobody needs another person making them feel like they are not doing a good job at it. Everybody is trying the best way they know how. Okay. Now, what is resistance? When MI practitioners say resistance, what is it? Resistance often means the therapist pushed too fast in MI. Resistance is not defiance, it's not pathology, and it doesn't signal a mismatch between the client and the therapist. Many times when we say, oh, the client is resistant, it's very likely we as therapists pushed too fast. Client was not ready to go that way and you drag them there. So if you learn to reframe it, you'll be patient with your client. So some of the MI inconsistent responses, we don't argue with our clients, we don't warn them, we don't shame them, we don't behave like we know how they should live their lives. I have a question for you. What happens when we tell clients, you must stop this? If it was you and you were struggling with something and you were genuinely trying to change for the better, and someone says, you must stop this, how would you feel? That's exactly how our clients feel. May we be congruent. May we be genuine. May we have deep empathy for the people that we serve. Another technique that, as part of the OARS, is rolling with resistance. Rolling with resistance. So, for example, a client says, I'm not ready to change. And my consistent response will be, you don't feel ready yet. Followed by, what would need to happen for you to feel ready? You realize there was reflection and there was an open-ended question. And so what we do is we reflect, we emphasize autonomy, we shift the focus, and we reframe. Anytime we are rolling with resistance, the techniques in rolling with resistance is reflect, emphasize autonomy, shift the focus, and reframe. Not argue, not shame, not push, not coerce, not force. In rolling with resistance, we use reflection, we emphasize autonomy, we shift the focus, and we reframe. All right, so let's see a case example. A university student who keeps skipping therapy sessions. Many of us don't like that. There are times, the truth is you are exhausted. So when a client skips, it gives you a chance to do something else or to rest. But when you know that coming for therapy consistently helps a client, you get concerned that they are skipping. So a therapist goes like, what makes it difficult to attend regularly? Do you notice there's just curiosity and not shaming? And the client goes like, I feel embarrassed coming here. And so in reflect, you go like, there's shame attached to being in therapy. No question, you're just reflecting. And many clients will definitely do, yes, my friends will laugh at me. So this is where you use affirmation. And in doing affirmation, you're doing reflection of meaning. You care a lot about how you are perceived because that's the core of the client. That is their worldview. They are looking at how people will laugh at them. And the client will say, yes, but I also don't want to keep feeling anxious. And so then this is where you come in with evoking the chain talk. So what might improve if the anxiety reduce? Okay. And this is where you set your client's thinking. And sometimes the thinking starts with just talking with you. And many times when we hear ourselves say something, that is the beginning of our healing. And so you hear clients go like, oh, I haven't thought about it like, oh, or this is the first time that is coming. I'm hearing myself say that. Okay. So let's take this case again. A university student struggling with anxiety knows that therapy helps but is skipping therapy. So me as a therapist, I'm wondering what makes it difficult to attend regularly. Client, I feel embarrassed coming here. Therapist, the shame attached to being in therapy. Yes, my friends will laugh. You care a lot about how you're perceived. Yes, but I also don't want to keep feeling anxious. What might improve if the anxiety reduced? Are you noticing that it's not a yes and no? Now I'm going to let you practice. And we are going to use let's see so we are going to reflect, we are going to emphasize autonomy, we are going to shift focus, and you're going to reframe. And this time I won't share with you mine. You get to do this on your own. Okay. So the man says, I am a man. If I don't beat her, she won't respect me. How will you reflect? How will you give autonomy? How will you reframe? If you have to evoke using an open-ended question, what would you say? Second one, therapy is for people who are mad. Me, I'm not mad. That's something we hear a lot of on the streets. What will you say? If you didn't pay attention and this is the first time you're paying attention, you probably do a simple reflection and then let's see if you can do a complex reflection. before you bring in um, the rolling with resistance techniques. Third statement, in my tribe, everyone drinks a bit. Why is he making such a big deal out of it? Remember, without the spirit of MI, you can't do the practice effectively. Okay. So that is it for the second part of our chat on motivational interviewing. Remember, motivational interviewing is a skill that develops through deliberate practice. So review the exercises and practice writing reflections daily. In our next lecture, we'll explore the four processes of MI and how to structure a complete therapeutic conversation. So, what are you taking away with you today? See you in the next lecture. Continue learning and go out there and serve with humility. Bye.